Head and neck anatomy, dissection of the anterior triangle of the neck. So, as you can see today, we have a pretty large amount of objectives. I'm not going to read them all to you. These are pretty straightforward from the dissector. And then down here I have the vast majority of bolded terms of the dissector for today's lab. Just paste it in here. We should actually be covering all of these, not only in the lecture before lab, but also in this short presentation. So if we have a look at the anterior triangle of the neck, we'll first notice the boundaries. One of the boundaries is the median line of the neck, which is the anterior boundary. Then the anterior border of the sternocleidomastoid is the posterior boundary. Don't forget the posterior boundary border was the anterior boundary of the posterior triangle. Okay, so this muscle has an important function in dividing triangles of the neck. And then we have the inferior border of the mandible superiorly. And then we have the superficial layer of the deep cervical fascia, which is superficial, so towards us, and deep away from us would be the larynx and the pharynx. So this is more or less where we left off last time. We will today first have a look at the superficial veins of the anterior triangle. You know, we have removed the platysma muscle. It's not in this picture anymore either, and so this should have revealed the external jugular vein. And so then if we would follow the external jugular vein superiorly, we should be able to see that it is made up of or created by the joining of the posterior division of the retromandibular vein and the posterior auricular vein. So the posterior auricular vein is here, and there's the retromandibular vein. Okay? If you have found your anterior jugular vein and it is still there and intact, you may be able to observe that it actually passes deep to the surface of the sternocleidomastoid to then join the external jugular vein in the root of the neck. If you have not, we might find that in today's lab or later on when we deal with the root of the neck. So you might have to refer to some of the skeletal models we have to identify some of our bony and cartilaginous landmarks here. So one of the most prominent features you can feel on yourself and on the specimen in lab as well is your hyoid bone. Hyoid is actually Greek and it means U-shaped. That kind of makes sense, it's very U-shaped. And then you have the thyrohyoid membrane, which I've actually superimposed in here. In this nether image it was not in there, so it will be right here in between the hyoid bone and the thyroid cartilage. And here is the thyroid cartilage. And thyroid actually also is Greek, well, actually thyroideus, and it means shield. And so this here is thyroid cartilage. These things we should be able to see. And then if you look at the skull, pretty close to the base of the skull, you see in front of this process, this is the mastoid process, not labeled though, and this is the styloid process. There's a long ligament that comes from it and attaches to the hyoid. So if it comes from the styloid process, goes to the hyoid bone, we'll call that stylohyoid ligament. That works really nicely. And then we have the cricoid cartilage right beneath or inferior to the thyroid cartilage, and then we have here the first few tracheal rings. So conveniently, as the anterior triangle of the neck would be a pretty big triangle, it's been subdivided into 4 smaller triangles. And so we will have the submandibular triangle, the submental triangle, basically directly under the chin, the muscular triangle here, and the carotid triangle that has a lot of important and interesting contents. So moving along, if we now move over to the muscular triangle, so the first subdivision that we're going to be dealing with, its contents are the infrahyoid muscles, thyroid gland, and the parathyroid glands. And its borders or boundaries are superolateral is going to be the superior belly of the omohyoid. The medial boundary or border is going to be the median plane of the neck, and the infralateral border is going to be the anterior border here of the sternocleidomastoid. So let's have a look here. Now we're going to identify some of our infrahyoid or strap muscle. Let's remember we have two layers. We have a superficial layer made up of the sternohyoid and the omohyoid, and a deeper layer which is the thyrohyoid and the sternothyroid. What we're going to have to do is we're actually ultimately going to have to cut through the omohyoid here, the superior belly, close to the hyoid bone, and do the same thing with the sternohyoid. If we reflect them inferiorly carefully, we should be able to expose our deeper layer of the infrahyoid muscles. So here's a little review, gross anatomy slide, or a picture from McMinn's again. Two of the key things here. Here is your sternohyoid muscle, and here is your omohyoid muscle. So the superficial layer of your strap muscles, and a couple of other little gems in here for you to study on your own time. So amongst the structures that we are supposed to identify, what you can do is you can kind of like pull the muscles to the sides a little bit, and then you can see some of the things we have to find. So the laryngeal prominence, for instance, your cricothyroid muscle, you should see it's really, really small. Then you have your cricoid cartilage, the first tracheal ring, a cricothyroid ligament in here, and then you should have the isthmus of the thyroid gland. See if you can find those, and you might have to resort to a better picture from Netter's or something similar. Moving on to the submandibular triangle, there are several structures of interest in here that I have listed. We will see if we can go through some of these for you, and then look at the boundaries here. So the superior boundary is going to be the inferior border of the mandible. The anterior-inferior boundary, you can see here, is the anterior belly of the digastric muscle. The posterior inferior border is going to be the posterior belly of the digastric muscle. Don't confuse it with the stylohyoid. Yeah, it's very close by, but it's not connected to the digastric. And then the superficial layer, the roof, is the superficial layer of deep fascia, and the deep is the mylohyoid, which you can see shining right through here, and the hyoglossus muscle. Okay. So if we then identify in this region, here's your mylohyoid muscle, there's your anterior belly of the digastric, and your posterior belly of the digastric. Coming from here, from the styloid process going down to the hyoid, is, who would have thought, the stylohyoid muscle. See, it gets pierced, or actually gets split by the posterior belly of the digastric. Don't forget that the anterior belly of the digastric and posterior have different innervations, which has embryological reasons. And so the anterior belly is innervated by the nerve to the mylohyoid, which is a branch of the trigeminal nerve, and the posterior belly is innervated by the facial nerve. So although these are connected through this little fibrous loop and through a little sling, they don't have the same innervation. Okay, and then you have in the midline, you have a median raphe, and that's probably enough if you can find those things. And then if we dig a little deeper, you might want to see the hypoglossal nerve. This is actually interesting and quite important for us. So the hypoglossal nerve is going to enter into the submandibular triangle by passing deep to the posterior belly of the digastric, and it'll pass deep to the mylohyoid muscle then, which is right here. So it passes deep to it, right in between the mylohyoid and the hyoglossus. So if you might have to use your probe and kind of pick it out there and pull it out, but it's quite obvious once you have it. If you find it, it'll go deep to your posterior belly of the digastric, and then it'll go deep to the mylohyoid. So one of the easiest triangles is actually the submental triangle. That's really not very spectacular. All we have in here, there's really not very much going on, are some lymph nodes, so submental lymph nodes, and it's actually also the only unpaired triangle, so this is the only one where there's no second triangle on the left or right side of the head or neck, actually in this case. And so the borders are, in that case, the anterior bellies of the digastric, as you can see right here. It's the right and left. The inferior border is going to be the hyoid bone, and the superior border is going to be or the roof will be the superficial layer of the deep cervical fascia, and the deep. So here again is a pretty nice cadaveric image. This here shows you quite a fair few structures that goes beyond what we've already talked about, but just I've superimposed here again with a dotted line the triangle, so the submental triangle. Lymph nodes have been removed, but you can see your mylohyoid muscle, you see your anterior bellies of the digastric, your hyoid bone would probably be around here, and yeah, all the other structures are for you just to have a look at, to review as well. And we can again see a little bit of our ansa cervicalis starting to peek through here. So now we're going to move on to, I think, the most complex triangle actually of the ones that we've talked about yet, and it's the Carotid Triangle. And the borders here, again, I've superimposed a little line over the triangle. You can see the inferomedial border is the superior belly of the omohyoid right here. The inferolateral border is going to be the anterior border of your SCM. The superior border is going to be the posterior belly of the digastric, which is innervated by what? Facial nerve, because the anterior belly is innervated by a nerve that comes from the trigeminal. In this case it's actually from V3 and it's called the nerve to the mylohyoid. Guess what else it does? The mylohyoid. So to go ahead and identify some more of the structures from our carotid triangle, you're actually going to have to go ahead and reflect the sternocleidomastoid muscle. It's already been reflected in this image from your dissector, but what you can do is you can locate the SCM and about 5 centimeters superior to where it attaches to the clavicle, you can cut it and then you can reflect it superiorly. And see if you can reflect it nice and high superiorly, because that'll make the finding of structures that are located higher up easier. Okay? And then you can see if you can find, while you're reflecting, you should find the accessory nerve that actually comes out of the skull, of course, comes through the jugular foramen, and it should enter the sternocleidomastoid, and then from there actually continue on to the trapezius. Okay? And quite nearby you should find the hypoglossal nerve that we've already identified just a moment ago, and you follow it, and you should see it gives off a little nerve that goes to the thyrohyoid, and quite fittingly it is called nerve to the thyrohyoid. Okay? And another thing that comes off of the hypoglossal nerve is actually the superior root of the ansa cervicalis. It is made up, though, this is the inferior root now, the superior root of the ansa cervicalis is made up mainly of fibers of C1, and then it meets up with the inferior root, which is made up of fibers of C2 and C3, as you can see here. So ansa cervicalis is the sling of the head, and it provides the innervation, as you can see here, with these branches to our strap muscles. So here again is a nice cadaveric image. You can see. So now we have a couple more structures to cover. So you can use this picture here on the left to review the veins and the course they take in the neck and actually beginning in the head. And this is a picture from the dissector that we've already seen a couple of times now. Just wanted to point out here, see, here's your carotid sheath with its contents. Most laterally you have your internal jugular vein, then you have your vagus nerve, pretty easy to find in it, and your common carotid artery, which will, if we go superiorly, split into the internal and external. So now if we briefly review the arteries or the branches that you should find, the internal carotid artery has no branches, at least not in the neck. It has branches once it's in the head, but not in the neck. And then you have the external carotid artery that has 8 branches. Actually 6 of these come off in the carotid triangle. Superior thyroid artery first, going downwards. Ascending pharyngeal is very small, tricky to find. It is on the prosection specimen, but it's not that great. The lingual artery is tagged. The facial artery is very curly. It's torn, but it's very recognizable still in the prosection. Then you have number 5, the occipital artery. Number 6, the posterior auricular artery. 7, superficial temporal, and 8, the maxillary artery. These here are pretty high up. Not 100% sure you will find them. Actually, I don't think you're going to find them, but you should definitely be able to find all of the other mentioned arteries. Okay? On a side note, look here, it says 20% of the time the lingual and facial arteries have a common trunk. So if you don't see them coming off the external carotid separately, just see if there's a bigger artery coming off, and then these 2 very characteristic arteries coming off of that. Well, that happens in about 1/5 of the time. So this is again a slightly deeper dissection. This time I think a little bit of dye or something was used. If you have it still preserved, you might find and might want to review your external jugular vein. Here's your sternocleidomastoid. Here's the lesser occipital nerve, so one of your cervical plexus nerves. Here's your ansa cervicalis. It's actually been folded back so that we can see the deeper structures, and the deeper structures within the carotid sheath were the internal jugular vein, which has been cut to give way to the view on the common carotid artery, and also the vagus nerve. And then here's your thyroid gland, which is also pretty easy to see, and some of your strap muscles, your thyrohyoid muscle, for instance, and your sternohyoid muscle right here. And again, the rest is for you for review. I find these cadaveric images quite helpful. So, dissection review, I'll leave this mainly up for you to read. Just as we usually do, I would replace most of the structures that we've dissected today and just review where they're coming from, where they're going, and if it's a muscle, think about its innervation. If it's a nerve plexus, think of its distribution. And same for blood vessels, please. And down here is again a link to a dissection video. It's again the same video or the same sequence of videos from the University of Michigan, so you can start at number 4, that's more relevant to us. And here the Wisconsin video again is also the same video, but they cover quite a lot of ground in it, and so it's still relevant for today. Okay? Great. See you all in lab.